now we're going to be looking at some neck exercises. So the first neck stretch that I want to review is going to be where we're going to have our shoulders back straight, and you're going to look forward. I want you to then take your head and you're going to tilt your head towards your shoulder where the ear is trying to meet the shoulder. Do not shoulder hike. Keep the shoulder down. You should feel this in this area of the neck going into the back. You can also increase this intensity by taking your hand and gently put it behind your ear and put a little counter pressure. Stretches should be held for anywhere from 15 to 30 seconds. You may feel tension, but they should be comfortable. Now you will do that on the opposite side. The next neck stretch that I'd like us to do is going to be where we're just going to be rotating our head. So again, you're going to look forward, and this time your head is going to move, and you're going to turn to one side, hold it again for 15 to 30 seconds. For demonstration reasons, I am not going to hold it that long. And then of course you would ask your patient to go to the other side for the neck flexibility exercise. You can increase the tension if you gently take your hand, put it on the jawbone, and counter pressure. And then return back to midline. And the final stretch that I'd like to do for the neck is going to be a chin tuck. And what we're doing there is you're going to look forward and then just tuck the chin, and you're going to feel it in the back of your neck. Now let's look at some shoulder exercises. Shoulder flexibility exercises are something that you want to incorporate into your plan of treatment. Let's raise your arm, take the opposite arm. You can either put it distal or proximal to the elbow or right on the elbow. That really doesn't matter. You're going to take your hand and you're going to bring your shoulder across your body. As you're bringing it across your body, you're going to use this hand to add the stretch. You will feel the tension in this part of your arm, your upper arm, and into the back. Again, hold for 15 to 30 seconds. Repeat on the opposite arm, and then it is okay to feel tension but not pain. Another very good flexibility exercise, we're going to raise our arm over our head like we're patting our back. Bring your other arm around, and again you're going to grab either on the elbow, distal or proximal, wherever you can get the handle, and you're going to put the counter pressure on and stretch. You're going to feel that stretch in this area of the upper arm. Repeat on the opposite side and make sure that it's comfortable. If your patient is unable to bring their arm all the way up, obviously you can work on that, and then this can be an ultimate goal. But you can also modify as well. And the next shoulder exercise is going to be where we're going to stretch our pecs and the anterior part of our chest. So we're going to start with our arms out in front of us, and then we're going to retract and bring the elbows back to almost like you're trying to touch your elbows. You're going to feel the elbows pinching, and you're going to feel a wonderful stretch in this area. You can alternate this stretch too, and it might be a little more difficult, is to clasp your hands behind your head, and then you can try to stretch your arms this way. Again, you can do this lying down or sitting or standing. Comfortable tension should be felt. Hand flexibility exercises are very important. You want to do gentle stretches, slow and controlled motions. Let's begin with flexibility and coordination. With your hand flat on a table, we want to just bring your index finger over and then back, over and back. If your patient has difficulty, you can have them just slide it a little. And then you can bring the middle finger to join them. And because the middle finger with the ab and adduction, it can actually be going to the ring finger as well. And then we're going to bring the ring finger over and then the little finger. And then just walk out the opposite direction. Very nice, gentle hand flexibility exercise. Now the next one that we want to do is going to be where you're just having all the fingers spread out together. So the start position is have them all adducted, and then in one nice gentle motion have them abduct to their fullest. Again, starting position, ending position with a nice stretch. Another nice stretch that we're going to do is having your hand flat on a table, and you're going to raise just at the PIPs and DIPs. So the MP head is going to stay on the flat surface with the palm, and you're going to bring your fingers up. Now some people who have basal joint osteoarthritis, they can't always put their hand flat on a table because of the deformity. If they have to have it cupped a little, they can still perform the exercise. If you need a visual to help with, a visual and also a physical cue, just have the other hand hold down and raise the fingers.